give me some space. So, so I thank you, everyone. It's a real pleasure, really, to have with us Dr. Brigitte Khoury, who is an associate professor at the psychiatry department of the AUB Faculty of Medicine, as well as the founding director of the clinical psychology training program, director of the outpatient adult services at the AUB/MC psychiatry department as well. Dr. Khoury is director of the Arab Regional Center for Research and Training in Mental Health. She is a consultant for several NGOs and UN bodies such as UNFPA, UNHCR, International Medical Corps, Médecins Sans Frontières, and has worked extensively with Syrian refugees since 2013. She is a founding board member of the Arab Union for Psychological Science, vice president. She is also the founding president of the Lebanese Psychological Association, which established the practice guideline and licensing criteria for all psychologists in Lebanon. Dr. Khoury has been voted as president-elect of the International Division of the American Psychological Association in 2018, and assumed her role as 2020. Most importantly, I worked quite some time with Brigitte, with all respect to titles. And one of the reasons why I really enjoy learning from her is the amount of culture, open-mindedness, and the way she handles herself being very natural and informal. Thank you, Brigitte. It's a pleasure having you. The floor is yours.
Thank you so much, Talia, for a lovely introduction. And thank you for the invitation. First, I want to say I love the title of the series, which is Kawakib. I think each one of us needs to be in their own planet, and probably we are at this point in time. I also would like to thank everybody who's attending. I know most of us have been on screen time since God knows what time today, so I appreciate your coming. So, very timely topic when we talk about mental health. It's always timely to talk about mental health, but even more so nowadays when we're going through very, very unusual times and a very unusual second year, I must say. Okay, let's see how to flip. Okay, there we go. So one of the major issues actually that we face with COVID-19 is the universality of the disease. This is something that actually really united humanity. We would have loved it to be something positive, unfortunately, but it has really put all of us, all countries, all humans to the test. Now, of course, there were other pandemics that, you know, in modern history, at least that were recorded, starting with the Spanish flu, moving into, you know, SARS, Ebola, HIV even was a pandemic when it started because we didn't know much about it. And yet, we really didn't learn much from these pandemics because they were on a very different scale. And they were more or less contained. So they were contained by country, by region, and it didn't impact all of humanity. Unlike, of course, what we are facing with COVID-19. It has affected all countries, it has affected all regions. I don't think there's any place in the world that hasn't heard of it. I know some countries do not have any infections, but most of them have suffered a lot from it. So how is it impacting mental health? I'm going to talk about 5 groups, actually, specifically on how COVID-19 impacted mental health on these groups, starting with individuals who were infected and quarantined, individuals who were hospitalized, family members of people who were sick, healthcare workers, and then the general community. Of course, in the community, we can go in more specifics, but then, you know, it will be an endless talk. So when we started, you know, facing COVID-19 and facing patients and not knowing what is happening with them, and having, you know, recommending the medical establishment recommending being quarantined, we didn't know what that meant. Part of it is just making sure that the person who's contagious is somewhere contained, but we really didn't think about the impact that would put on people. And when we started talking, and when we had at AUB, we had a service from our department where we actually reached out to people who were infected, who had COVID positive, but then who were not too sick to be in the hospital but needed to be quarantined. So we actually offered them a service of reaching out to them because we realized the isolation was very, very difficult on them. And what they talked about the most was there was a sense of isolation. Of course, all this was done through online and internet facilities. The sense of isolation was the first thing they mentioned. And the shame and the guilt, because suddenly they were stigmatized. They had something that needed to put them away from society. Of course, with no explanation, because early on we didn't know what was going on and what is happening. Of course, that caused them a lot of anxiety, having low mood, not necessarily getting depressed, but definitely having low mood, feeling very lonely. And then as we walked with them through the quarantine, because what we did, let me tell you about our intervention, we actually called people every day. So we had volunteers who we had the list of people that we get from the COVID clinic every day, and we would call them every day just to check in, how are things going, encouraging them, what to do with the limitations that they have. And all of them mentioned being worried about the post-quarantine. So after they leave, what will happen? And most of them, a lot of them were scared of the stigma that will be attached to them. And we know of cases and many incidents that happened around the country where people were stigmatized and were put aside even after they recovered and they were okay. And this was really in the beginning, and when still we didn't know much about it. And of course, didn't have the humongous amounts that were spread now. People in hospitals, of course, were more seriously ill, and we also tried to reach out to them. So we had a team that would also, the nurse on the unit will give them a tablet or their phone, and then we would talk to them over the phone as much as they could. They were also feeling very anxious and very worried. They didn't know, what would the outcome be. It was a day by day. As we know, of course, initially we didn't have much of a treatment. It was really touch and go, everything that was going on. So the medical health workers and the establishment was learning how to deal with the disease as the patients were also learning how to deal with it. They felt very lonely, and you can imagine being in a hospital, especially in our culture, you're never alone in the hospital. Usually you have family, you have friends visiting, you have people around you. And this was such a unique experience of being in the hospital, surrounded by strangers, people who cared, of course, but still strangers, with no sense of control, very little information or no information as to what can happen. And of course, the ultimate fearing death, fearing dying, leaving the family, everything changing, just at the drop of a hat. So, of course, a lot of the patients we supported were able to get out of the hospital and feel better. Unfortunately, some didn't make it. And then we had the family members to deal with. And that's the most difficult part. So while their family members are ill or they're sick, they're in the hospital or at home, of course they also, you're going to see the theme of worry and anxiety is all through the presentation. There was worry, there was anxiety, there was also a fear of being contagious and being infected, but also giving, if you are contagious, to also give the virus. So there was a fear of that, as well as the fear of stigma from the patients if they leave, after they leave from quarantine and they're out in society. And the family also feared being stigmatized itself because of a family member who is sick. And we also saw this thing, and we also heard it. And it was very, very difficult for them to face suddenly being stigmatized just because one family member was ill. And of course, the fear of loss when they have somebody who is sick. Again, they didn't know what is going on, what is the prognosis of the disease, the progression of the disease. So there were a lot of questions from family members that were very, very worried. And then, of course, we get to family members after a loss and after they lost someone to COVID. And this is very particular, actually, and I find it very interesting, but also very sad. The sadness and the pain of the separation and loss is immense. Especially, and what is always repeated, and I hear it from people that I know who lost somebody. I see it now in the literature, there is more writing about it. The family member dying alone and no space to say goodbye and no time to say goodbye. And all they do is sometimes being able to look at them through a glass window, but that's it. And this is very hard. It's very, very tough on people. So the mourning phase, which we have and is very cultural and has a reason to be there. There is a reason why we have all our rituals, broke completely. Suddenly, there were no condolences. There were hardly any burial ceremonies, hardly any people that will join, no social support, no retelling of the story, which is usually very cathartic. People feel better when we go to condolences. They talk about the person they lost. They remember the good times. People come in, you retell the story. It's very ritualistic, but there's a reason for it because people feel better and they're never left alone and there's always people around them helping. During COVID, people are losing people alone, they are mourning alone, and now they are grieving alone. And that level of grief, when it reaches a certain level of the stress, let's say, can lead to depression. And now there is more and more talk. There is something called complicated grief. Grief is normal. Everybody grieves. الحداد يعني. It's normal when you lose someone, we're sad and it takes, months or weeks. But then we're looking, could there be complicated grief, which is the grief that lasts years? And this is considered actually a psychological condition, being unable to overcome the loss of a person. But then if we didn't go through all these phases, there could be very much complicated grief. I spoke to an elderly gentleman who's our neighbor in the mountains who lost his wife, unfortunately, who was elderly. And he told me he was crying on the phone and he said, Brigitte, I couldn't say goodbye. I told them, please have the coffin pass in front of the house. So I just say goodbye from the balcony. These are heart-wrenching stories that we hear. And this is not going to be swept away so easily. And I think people will suffer a lot and we will see it coming soon into our clinics with this level of really complicated grief. The healthcare workers, our angels, who were thrown literally into the pit, again, not knowing what's going to happen, not knowing what they're facing, what they will be facing, what is the outcome of it, and yet, they did amazing work. But yet they had no sense of control, again, and little knowledge of the disease, which makes it very difficult. So we have, these medical professionals who are trained and know exactly what to do in every situation, suddenly faced with something that they are trying to handle every day at a time. The impact of it and also the magnitude of it led to burnout very quickly. And the burnout sometimes can lead to depression. The stress level, being very stressed, can lead to anxiety, and we have seen this happening. And most important, they were suddenly isolated from family members. If you remember in the beginning, the nursing staff and doctors were sleeping in hospitals because they couldn't go back home, fearing that they might infect their family members. Some areas, they were donated houses and apartments to, or hotels opened their doors to accommodate them. So this is suddenly very, very difficult. They're in a very stressful situation without family support. We've all seen, Mother's Day where our nurses were congratulated and on the phone with their children, and which is very, very difficult. So at the time when we need each other the most and we need family members the most, we are isolated the most. And this makes it, of course, can lead to a lot of problems unless people have the support they need, which is offered by hospitals. And I know all hospitals have offered a lot of support, psychological support and psychiatric and counseling to members of the staff. So they also were scared to get the disease, to be infected themselves, and to give the disease. So that also puts, it's a kind of a double-edged sword. And in one sense, you know, you're worried that you will be the patient, and you know, you see what's happening with them, and at the same time, you're worried that you can cause somebody to be a patient. So a very difficult situation. And the most difficult I find, again, when we go back to losses and grief, is that the health workers suddenly became the mediators between the families and the patients. They were the ones who can talk to the patients, be close to them, hold their hands, appease them, give them the phone, give them the tablet, talk to the family. And that's an additional level of burden, which I know all of them did superbly well, but that is very emotionally draining. And on one hand, they want to care for the patients. On the other hand, they see the families in distress and they're trying to appease them. And we've seen many, many situations where the nurse is the last person to hold the hand of the patient who died, the last person to say encouraging words. And this, again, is very difficult. And this is something I don't think in any profession one is trained for. And then the community, where we are, completely bombarded with information. Suddenly, of course, everybody becomes an expert. Rumors are spread thanks to social media and the internet, fake news, and the inability to differentiate. And we see it now with the vaccine, as I'm sure you've read and you've seen everywhere. It is good, it is bad. This one is good, this one is bad. If you take this, this will happen. And most of it, you know, not based on anything scientific or medical. As they said, it's all reporters actually now are making medical decisions or giving medical advice. So there is a sense of fear and anxiety, of anxiety, which is very normal facing a situation that we don't know, and a big sense of missing out. And this is something we see across all levels, ages, groups of society. Missing out on special occasions, missing out on activities, missing out on school, on classes, on university, on a life, missing out on friends, missing being touched, missing being hugged. And now a lot of it took a while, I think, at least for me, to refrain myself when I see somebody not to kiss and hug and just stay, you know, standing and just wave and, you know, throw a kiss blowing in the air. Now it's automatic. Automatically, you don't get close. You keep distance, you know, and so this became our habit. While initially, you know, we were much closer. A term that's coming up now is quarantine depression, and it's more and more being talked about and being published on. And what it means, which is ironic that I'm talking about this at the end of our 3-week quarantine, is emotional exhaustion. And I'm sure if I ask now people listening to me how many feel that, a lot of you will shake their heads that it's yes. It is emotionally draining to be home all the time. Try to have a level of normalcy. Try to have a minimum level of social interaction and face a very big problem that's outside in the world, and try to think of the future and try to make plans. So there's emotional exhaustion on all levels. There is also loneliness. And I'd like you to think, I mean, in Lebanon, more or less, we are, most of the times people live together. So you hardly have people living alone, unlike in the Western world where you have many, many young people or elderly people living alone, sometimes in very close quarters. And this is very, very difficult. My cousin who lives in New York, when the pandemic started, he told me, he said, I haven't talked to anybody in a month. In 1 month, I haven't talked to anybody in person and confined in a very small space. Very little social contact, which is against our nature because we are social animals, of course. So it's against our nature to put these limits to the social contact. And yes, I know physical distancing is not social distancing. We know that. And thanks to the internet and all the platforms, it makes it easier. But somehow it is not the same. I was just saying now before we start that maybe in another year or 3 years ago, we would be in a room somewhere where I'm giving the lecture and later on we'll have a coffee and chat and discuss things. Now we cannot do that. But and I think I personally definitely miss that level of social contact. No activities are being or very little is being done during quarantine. Everything is within closed doors. And the pace of normal life is altered. You know very well, we're not waking up the same way we used to. We should, but we don't. Same thing, we don't sleep when we should, when we used to, yet, you know, we should. So the pace is altered because we don't have the regular demands in our life that are usually present. And then the challenges that I started with is the full reliance on technology, the screen time, which makes us connected as well as socially disconnected. So we can, I'm sure you all know, you can sit and have a coffee with a friend for 3 hours and chit chat and have fun. I don't think you can sit and talk to them for 3 hours on a screen. It's impossible, no matter how much you love them. No matter if it's a family member that you adore, I don't think more than 10, 15 minutes you can be on a Zoom call with them because somehow there's nothing much to talk about. Yet when we're together, having a social gathering, we have plenty to talk about, and you can spend weeks and days and weekends talking to people, and that's the difference. So that's been an uphill challenge. And then our home environment is altered. Our home environment now is not the home where we go back after work to relax and be with family and enjoy. And now it's an office, it's a school, it's a clinic, there's administration demands, while at the same time there are home chores and home life, and the demands are still continuing. I'm sure most of you have been on Zoom calls while, I don't know, somebody is peeling potatoes next to you and the guy from the delivery is arriving or bringing the water or coming from supermarkets, and the Natur is, calling you because he needs something. This never happens when we're in a regular work day in our regular office space. But now, like, the worlds collided, and it's very difficult to be able to maintain a balance between all of these worlds. So what's going to happen with the post-COVID era, which I'm hoping will be soon? Will there be one? People are questioning, are we going to have a post-COVID era? Or are we going to keep all these changes? They will be maintained and we will keep them. Are we going to return to what pre-COVID was, which I doubt very much, because now we learned things. We realize that we can adapt to almost the impossible. So some things, the positives probably will be kept. There's a lot of anxiety about the future. I used to travel at least twice a month. Now I cannot imagine getting on a plane because I'm just thinking all the risks I will be taking, from the taxi to the airport to this to the plane to all these to everything I'm going to touch, and that alone becomes a very, very big deal. So there's a lot of anxiety about what is waiting for us. What is the vaccine going to do? Will it help? The long-term effects, the short-term effects, plenty of questions. And so that gives us a very limited sense of control, which we humans do not like, by the way. We need to be in control. We like it. So when we're not in control, it increases anxiety, it increases fears, and we try to focus on being day by day functioning. And are we looking, and these are all questions, of course, I don't have answers to, the changes that are permanent, are they going to remain permanent versus the changes that revert to the past? And what will be that? We hear a lot now that, school learning and online learning, of course, is going to continue. Maybe not at the level that they're doing it now, but it will be incorporated maybe in the regular curricula, possibly. Same thing about telehealth or telemental health, that this will also be, 2 or 3 years ago, I used to have maybe one session on WebEx or Zoom with patients who were abroad. Now I have patients who live in Hamra who don't want to come to the hospital, and I don't blame them. Out of risk, that we do sessions online. So this also, the whole service sector has changed when it comes to health services. So what is the outlook on the future? A readaptation to a new life, or an adaptation to a new life? And interestingly enough, the American Psych Association issued a very strong statement and concern that the next pandemic is actually a mental health pandemic, which is going to come out of the COVID-19. Is this true? We don't know. Are we seeing a rise in mental health problems? Absolutely. We have more and more patients every day. Is this going to last? It's impossible to tell, but I know that what we went through is not going to go unnoticed, and it's not going to be swept away so easily. So what we can do is gather our lessons learned from all the fields and all levels and put our heads together and see what we learned, keep the good, remove the bad, and I hope not, but maybe brace ourselves for another pandemic, something that can come in the future, which I have no idea what that can be. And I have this vision and this wish that we will have at some point a world meeting on COVID-19, meaning that all the fields will come together and talk about how that impacted humanity, whether health, economics, sociology, ethics, biology. I mean, all the fields really coming into one meeting and talking about this amazing experience that humanity faced, hoping that we're going to get out of it. I sincerely hope we will. We probably will, but the impact of it, I think, is not going to be forgotten anytime soon. It has shaped our history and our future for years and years to come. I'm going to stop here. I ran over the time probably a bit, but so I would love to hear your input, your comments, your questions. I will stop sharing the screen, and that way we can have a conversation.
So thanks a lot, Brigitte. In all fairness, I thought it was like 4 minutes only. So we were taken by Anjad. Thank you very much. I'm not going to ask any questions. I'm sure others have a lot. I personally have had a very bad experience with COVID, losing maybe the dearest person to my heart. So I'm not going to go there. But I want to say one thing before I leave the floor to my colleagues and friends and participants. I've always said to my students in medical school, and I say to everyone, psychology or psychiatry is the mother of all things related to medicine. It's not an add-on. Unless you know psychology and psychiatry and know how to deal with patients and to understand them, whatever you do in medicine will be always missing or faulty. So thank you for being with us, Brigitte. Really appreciate it. And I'm going to leave the floor to questions moderated by either Tala or Diana. And I will sit back and
listen. Type them in the chat also if you want.
Also, yes. Yeah. So تفضلوا. If you have any questions or comments to Dr. Khouri, please go ahead.
Or experiences or anything you'd like to share.
Yes.
I will go ahead and ask a question.
That's okay.
So you mentioned the worry about an upcoming mental health pandemic, and I mean everyone is like becoming more aware about their mental health status and how it's been impacted by the pandemic. But we're still sort of in denial of how this is going to affect us on the long term. I mean, we all joke about it and it comes up in our daily lives. But I think the majority of people still are not fully aware of how to handle this and what they should be doing. So what is what can be done on the grander scale when it comes to, I mean, yes, there's a lot of awareness these days about, but is there a need for a bigger push in that aspect?
I think the push definitely needs to happen on an awareness level. And you know very well when you catch things early, you deal with them much better. It's like, you know, the noise in the car. We hope it goes away and it never does, but then it gets worse. And health is the same thing in mental health also. So I think being aware of how we can be impacted and being aware that if it reaches a certain level where it is really impacting our daily life, our functioning, then to seek help as soon as possible, because then it can be managed on a much easier level now, or much, you know, an early level and a much better level. Now, what are the things that can help? You know, it's the standard things that, you know, we tell everybody. Try to keep, you know, a normal daily life, contacting people, talk to people who you like, who are close to you. I always say, try to stay away from toxicity and negativity. And we have enough stress in our life, like you don't want any additional stressors that come from other sources. You know, learn new things that make you happy. You know, a lot of people took off coloring and this and many activities, photography, etc., while they were confined, music. So all these things, the little things that, you know, sometimes you say, ah, come on, that's not important. But, you know, little things are what make our life, what make our daily life bearable. So these are the things that one can do, you know, on a personal level, but on a bigger scale, I think offering support to pretty much everybody, institutions, companies, being able to give their employees and everybody who works there a space that where they can talk, they can access somebody to help would be very important. And this is what we're doing, for example, at AUB and AUBMC. I don't know if the person who asked this from AUB, but so talking about it and saying it's okay. It's okay to feel anxious and not sleep, and it's okay that to feel down because you couldn't spend Christmas with your parents because they're elderly and you don't want to put them at risk. It's okay. It's normal. Maybe now we need to start normalizing the painful things that we feel and talking about them. That will hopefully move away from then the pathology. I don't know if that answered your question, but I'm hoping I did the best that I can. There's a lot of comments on the chat. So Honey Slim, I want to ask about the COVID virus impact on the brain itself and how this can affect the mental health. That's a great question. I wish I had an answer to it. I don't know if anyone does, and if anyone does in the audience and knows more, please feel free to interject. I'm not sure if there's still any research or yet any research about this, but what I know is that there is something now, what we're talking about is the post-COVID recovery. And in the post-COVID recovery, one of the help that we are offering actually is things related to memory and some cognitive delays or some cognitive problems that could be related to the COVID virus itself. The jury is not out there yet. We don't know. But these are things that in the post-COVID clinic, we are starting to offer that people who are recovered sometimes, and again, who is it? Is it everybody? Is it only the elderly? Is it only the young? I mean, we don't know. But some people do have some cognitive deficits, which, you know, can be remedied. But I would be very, very interested to see the research on that. I don't know if anyone has any answer on this or any knowledge.
Dr.
Yeah.
I have, I'm sorry. No,
I
go
don't know
ahead.
who's talking. But
It's Wajiha.
hi, Wajiha. Do
Hi.
you have an answer to this? Yeah.
So actually, I don't have an answer, but I'm on a lot of like Facebook groups about COVID. I guess this is part of my neuroses, and it helps me lessen my anxiety if I read everything there is.
Oh,
It's
really?
my way
Because
of
that
dealing.
that increases mine actually.
Oh, yeah. So yeah, different people have different ways of dealing with
Of
things.
course.
So a lot of people have reported that they've had patients who are months post COVID, waking up in the middle of the night gasping for air. And there's so a lot of like there's a lot of psychologists and psychiatrists on the field that, and they were saying that they're seeing this a lot in the States. And I'm not exactly sure, and there's nothing physiological, as in lung wise. They have good lung function and everything, but somehow the fear of, I guess, dying comes back to haunt them later on. So so definitely there is some like lingering mental health issues that are happening even like in patients, not just from the isolation and even from the disease itself, it seems. So
So maybe like
yeah.
panic attacks or something
Yes,
like that.
exactly. Yeah, it's probably like some sort of a panic attack that's happening. Yeah, they just wake up gasping, and so many
Yeah.
people have reported this. So
Yeah. So that's definitely could be. Again, there's so much still that we don't know, and we need to learn more about the impact. So somebody's asking the impact on children. I would like to ask about that. Oh, that's a big one. The impact on children I mean the impact of so many things on so many levels. The disruption of their daily life, the no structure, no schooling, no activities, the disconnect from their friends, the screen times, if I may add, that they spend, days and hours on, partly for schooling, but then also, to be connected to their friends or for games or whatever. So the impact is huge. But also, children are impacted by adults, and the way they see their parents deal with things, well, depending on the age group, of course. But the way they see their parents deal with things is the way that they will also deal with it. So if there's a lot of anxiety at home and there's a lot of talk and there's a loss or there's sadness, they will be impacted for sure. If you can, as much as possible, keep a level of normalcy, which I know is ironic during these days, but as much as possible, include them, involve them, give them the information they need at their level. So, a 6-year-old is different than a 12-year-old. That would be very important. And again, they are kids, try to do the things that they can and they like, and I don't know, watch Disney movies and be in a world that they can still be in to relieve them a bit from the harshness of the real world they're in. So this is like in a nutshell. We need to have a national emergency preparedness plan or strategy, absolutely, including a mental health prep program. Well, we have the national mental health program actually from the Ministry of Public Health, who is trying to do, they're doing great work. They put together lists of professionals who are willing to help, to donate their times. But when we talk a national level, there's always something lacking, unfortunately. But I know that the mental health program itself is trying to fill in the gaps as much as possible and provide the services that are needed in the hospitals. Usually when facing dilemmas, mainly in mental health, we encourage resilience to strengthen coping strategies. Yes, but knowing the dimension of the burden of the pandemic fueled by the continuous living crisis in Lebanon, do you think there is still a place for resilience? And if yes, how? If I had an answer to that one, I'm not sure we have a choice, actually. Sorry, Tatiana, are you the one who asked the questions? Do you want to say something more about it? I heard someone speak. Okay.
Yes,
Maybe not. Okay.
speaking.
Okay.
It's Mimoza Arawi. But this is what that has. I would like to ask you, maybe it's something a bit complicated, but I wonder what can you consider normal? For example, if somebody after losing a person that is very dear to him, look, not being before, and you think that maybe you gave it to this dear person, يعني it's been a month, for example, you feel that we consider depression not maybe it's the clearer way of seeing life as it is. No, it's not depression. It's being more realistic. This. I don't know if I explained.
So your voice lagged. Okay, your voice lagged a bit when you were explaining, but let me see if I got it right. So you're saying if somebody has lost a person to COVID and their reaction to this loss is not depression, and it could be just basically the normal process of grieving. Is that what you're asking?
No, I meant no.
We are losing your voice. Maybe if you write it in the chat, please. No, it's not coming clear.
Okay.
I mean, every experience marks us for sure, especially the hard ones. I'm sorry you're breaking. I hear bits and pieces. I'm trying to put them together.
Change in your perception. Do you consider this normal, or you think it will pass? I don't know if I explained myself well.
I'm sure you are, except that the internet is not helping because you're breaking. So if I understood correctly, so basically you're saying that if you react, like, how can you cope with this loss while at the same time going on with your life? Is that what you're asking?
So I think, if I may, Brigitte, and I think I know what she wants to say, and that she said in addition. Okay. So her question is basically, what is normal? Is what we consider abnormal post-death actually abnormal, or this is just an awakening to the normal state of life?
Talia, I think with your philosophy background, you can answer that better than me. I mean, of course, death is a part of life, of course, and it is a normal process that everybody goes through. Now, if people are sad, sadness after loss is not depression. Depression is something very different. And we all have normal reactions that everybody feels, and it's okay to be sad, to feel down, to cry. Now, if it's lasting longer than usual, than what the culture usually allows, and this is what I was talking about when I talked about complicated grief, is that usually I always say grief takes a year. I always say it takes all the holidays to pass and all the special ceremonies to pass when we remember the person we lost. After that, people start more or less normalizing. It doesn't mean they forget, of course not. You will not forget the person you lost, but you more or less move on and normalize with your life. With complicated grief, it might take longer than that. Now, in our culture, a year is acceptable, okay, more than that would be unusual. On a psychological level, it would be unusual. But considering the circumstances and the losses that we are experiencing now and the way this is happening, the way the losses are happening and the death and the mourning and the lack of mourning, this is what might lead us to more complicated grief that will last longer because we didn't have the chance to actually grieve altogether culturally and normally in a way that we are used to. So, but I will be very careful when you lose someone to say, oh, after a month, خلاص ماشي الحال, no, it's okay, you need to rebound. No, not at all. It takes sometimes months to be able to, get back more or less to your daily life. And that is not depression. So, and that, does not need necessarily treatment. Okay. I don't know if that answered her question. I hope.
Brigitte, so I think we still have some questions from Sanai, and I don't know if you.
So Hazar, for instance, we currently seeing a lot of adults and children facing mental issues. While there might be many resources to help them cope, I'd like to know about any existing resources in the Lebanese context to help out people. Yes, of course, we have many resources. Actually, on the website of our department, psychiatry department, we posted many resources for children and adults dealing, with COVID-19 issues, with anxiety and depression, how to deal with that. So if you just go to our website, the psychiatry department, you will find these resources. The Ministry of Health also has posted many resources on their website. MOPH, Ministry of Public Health in Lebanon, you can also find these. So yes, I definitely, please feel free to check them out. Do you think that COVID will increase or even trigger OCD in some patients? That's very interesting, since the only measures that people have control over are hand washing. Now, interestingly enough, that's exactly what we thought. I personally thought that patients that I see who have obsessive compulsive disorder, that's OCD, will get so much worse during COVID because they have to wash and more, and now everybody almost is becoming obsessive with washing and disinfecting. Interestingly enough, when I see my patients who have OCD and I ask them, from the guy, I said, is it worse because of COVID? And they're like, no. We know the difference between the COVID washing and need to disinfect and the obsession and compulsion of the illness, which is fascinating. They know exactly the difference and they know how to differentiate, and they know when this is actually for the COVID and for them to be healthy and be safe and be secure, and what they're doing as unfortunately rituals following the illness. Now again, is there data about this? I don't know. I have also read, on another hand, that this has increased OCD in some people. So what I saw personally is that, and I've from many people, not only one or two, that they know the difference. But it could be that also in some other places, or people who have some additional maybe stressors or too much going on in their life, that it could increase. So it could go either way. Sadness, pain of separation, complicated grief after death of a family member due to COVID. I wanted to ask about the survivor guilt. Yes, that some might experience. Can this later on lead to a more serious mental health problem or psychological condition? That's a great question, because survivor guilt does exist, and we see it a lot with COVID. Patients with families who lost people to COVID, or even COVID patients who recovered, and then someone else they know didn't. And it is very much present, and we see it a lot. And survivor guilt, for some people who are not sure, it's basically when you lose somebody and you feel guilty that you're not the one who died and you survived. It happens in big accidents sometimes. It happens in disasters. Can it lead later on to more serious mental health problems? It can. There is no way of saying yes for sure or not, but it's definitely something I would keep an eye on. If it develops into more symptoms and more problems, then I would suggest, to get some psychological consultation. But that's important to keep in mind. But it is, again, there's a certain level of normalcy to what we see now. And I hear it actually more from people who lost young people. It's kind of, well, they're elderly, at some point, unfortunately, they were going to go. But when it's a young person, you hear it a lot. Okay, so Mimosa, we got looking at life as something grieving in general, and it is natural, not a disease. It is seeing, it's the same thing. I'm a learning support teacher. Okay, you mentioned the cognitive problems that might be part of the side effects. Some of my students faced this, and it's been so challenging to catch up and be back on track. Even I've been thinking of new strategies to help them out. My question, I've read that patients who had COVID had no prior neurologic disease. 57% of them showed abnormalities on neurological exam. Do we expect our students to face more cognitive problems after having COVID? That's, again, a very interesting question. And I don't know if the age might be a factor. to this. The 37% who showed abnormalities that you mentioned, I don't know how old they were. But yes, it could be. And you mentioned that some of your students who had COVID, you noticed had some cognitive deficits later on upon recovery. So yes, this is a possibility. We cannot say that it is necessarily the case, but I think it's definitely something to keep in mind. If you do notice that the cognitive problems are increasing, or they are not just, passing, or it's just a phase, I would recommend to have some cognitive testing done, just in case. And sometimes it can be remedied, it doesn't have to be completely permanent. But yeah, again, there is still a lot that we don't know about the impact of it. And it seems that there are some cognitive problems. Can COVID trigger somatoform disorders? I guess it can. I don't think I have seen that yet, but so somatoform disorders are basically problems psychological problems that manifest themselves in bodily symptoms. So it can, I mean, I don't have an answer that is yes or no. I guess it can, like any stressor actually can trigger a somatoform problem. If the person is sometimes unable to express it in mental symptoms, meaning in anxiety or depression or any type of psychological symptoms, it can definitely manifest itself in physical symptoms. I think so. I think that's for the chat. Any other questions you have or comments?
It's your fault, Brigitte, because it's so interesting, and what you're presenting is so interesting. You're being bombarded by a number of equally interesting questions.
What about social anxiety? Susanai is asking. So is COVID triggering social anxiety? The thing is with social anxiety, people who have it do very well during COVID because of the lockdown, the limited social interaction. So I have heard it from many of the people that I see who have social anxiety that say, oh, it was so good now, I was at ease, I was home, don't have to interact with anybody. So I'm afraid that the COVID situation is making things worse with people with social anxiety, because if you tell them to face their fear and, go out and meet people and, do this, and then they cannot because, it's not allowed, it doesn't really help. And people with social anxiety, by the way, have no problem sometimes being online, or, they are more incapacitated in real life than through the internet or on platforms. So yeah, it doesn't serve it well for COVID. What about family members unable to go back to their home where they lost the loved one was? It takes time to be able to, yeah, oh yeah, absolutely. I mean, and this has nothing to do with COVID. I mean, it has to do with loss, basically. It is, of course, very difficult because that space, triggers the memories and the feelings and the experiences lived with that person. I think doing it gradually, and I always say, whenever people are ready, they will face it and they will do it. So sometimes it takes a little nudge from the family members, but it's understandable that it is difficult, but it can be, faced later on at their own pace.
Hi, Brigitte.
Hi, Marianne.
Anna, I just thank you so much for this wonderful talk, but I want to shed something a little bit positive from a pediatrician's point of view of what's happening. The parents are actually catching up on the milestones of their kids. So when they come for well visits, they're actually saying we're enjoying our kids because we would have been at work had it not been for the lockdown, and we would have missed out so much. So there is a positive aspect for it. And I'm not going to mention how much the kids are missing because they're not getting social interaction, but at least I think as a family, it's bringing a lot of families together, and we're seeing that the parents' feedback is reassuring in some ways. Let's put it this way.
That's a great comment. Yes, absolutely. Thank you. I mean, families now have rediscovered each other. And I hear this, by the way. And I see people telling me this, that, I haven't sat and talked to my father in months, for example. So yes, so there's always a silver lining, I guess, on everything. And that's one of the positive experiences that we can say COVID, caused people to do. Besides, of course, the less pollution, less using of transportation. I mean, all these things that, the planet can breathe finally. So there are, yes, things that were positive. So thank you for mentioning that.
So it's already 7 and I have to be respectful of your time, and I see you're still at the office or the clinic. So go to your kids, your husband is away. So really, God bless you. Thank you. We will keep in touch for further collaboration as usual.
Thank you. Thank you so much. And thank you all for coming. It's a pleasure.
Thank you all. And see you during the upcoming Kawakib webinar. Bye-bye.
Thank you
Bye-bye.
so much. Bye-bye.
Thank you, doctor.